Hey guys, Well Ministry President here. Happy Black History Month. February is not just acknowledged for Black history, but it is also acknowledged for Heart Disease Awareness Month. Did you know that high blood pressure and heart disease is the most common issue in Black and African American adults? Hypertension, which is also known as high blood pressure, is one of the most common issues concerning the heart that can lead to heart disease and stroke. Blood pressure is the pressure of blood pushing against the walls of the artery. The human body has a network of blood vessels called veins and arteries. The arteries are what bring blood from the heart to the rest of the body, while the veins bring back that blood from the rest of the body back to the heart. According to the AHA, American Heart Association, normal blood pressure is usually supposed to be up to 120/80, while hypertension, also known as high blood pressure, is usually starting from 130/80. Heart disease refers to many different types of heart conditions. Coronary artery disease, also known as CAD, is one of the most common types of heart issues in the United States, which affects blood flow to the heart. The prevention or lack of blood flow to the heart can cause what we know as heart attack, myocardial infarction. CAD is the buildup of plaque in the walls of our arteries. And plaque is usually made up of deposits of cholesterol, which comes from the foods that we eat. Coronary artery disease is the main cause of heart attack. The heart itself is a muscle, and it needs blood too, just like the rest of the organs. So when there's a blockage, that can cause a heart attack. Symptoms of a heart attack includes chest pain or discomfort, which usually is on the left side of the chest, and it typically feels like a squeezing, crushing pressure. Shortness of breath, which usually comes from the chest pain. Pain can also radiate to places such as the jaw, the arms, the neck, and the back. In women, lightheadedness, tiredness, and headache can be found as well. A stroke, also known as a CVA, is when blood is blocked from a part of the brain or a blood vessel bursts in the brain. For warning signs of a stroke, you must think fast. The F is for facial drooping. So you want to ask the person to smile because one side of the face may not look the same as the other. The A stands for arm weakness. So make sure the person can raise their arms without it dropping. S is for speech difficulty or no speech at all. So make sure that the person knows how to speak and is not jumbling their words. T is for time to call 911. Remember, time is brain. Head to your nearest hospital or stroke center. It is best to handle this matter within the first 3 hours from the time the stroke started or signs were observed. There is a mini version of a stroke, which is known as a TIA, transient ischemic attack. A TIA is different from the major type of strokes because blood supply is blocked from the brain for no more than 5 minutes. Still go seek medical attention. People at risk for high blood pressure and other heart problems include smokers, diabetics, people who are not physically active, as well as people who eat high-fat cholesterol and high-sodium salt diets, as well as alcoholics. So, how does one decrease their chances of having heart issues, you may ask? More physical activity, limiting alcohol consumption, stop smoking, managing your weight, and lowering your sodium, cholesterol, and fat food intake. There are special dietary habits that one can take to reduce their chances of heart disease, such as the DASH diet, DASH, dietary approaches to stop hypertension. This includes vegetables, fruits, whole grain, fat-free or low-fat dairy, limit sugary sweetened beverages and sweets, high saturated fat foods, so fatty meat, coconut oils, full dairy, and processed foods such as frozen foods. Though we acknowledge this month as Heart Disease Awareness Month, let us take the time to be aware of this matter, but not accept defeat. Get active and change your eating habits. For more information, you can go to websites such as AmericanHeartAssociation.com and AmericanStrokeAssociation.com. Well, Ministry President, over and out.